I talked to a bunch of public health experts last night just to get their takes on these new guidelines, and many of them who've been critical of the president throughout this said there is a lot to like in this, except there's one major problem at the center of it, and that is there's no plan for testing. So how exactly do we measure if these states are gated? Have they passed through the gating and they're ready to now phase back into normal life? Yesterday in the briefing room, our Hans Nichols asked the president about testing.
Are you opening things up without doing widespread testing? Is that because you don't have the capacity or you don't think it's necessary?
You do have the capacity, but, you have states without any problem. You have states with few cases, and those few cases have healed. You have states with very little death, relatively speaking. As I said, one is too many, but you have states with very little, and frankly, they're at a point where they have almost nothing. So this is a much different case than a New York or New Jersey.
So, Joe, that's the argument from the president last night. He clearly wants to get places open quickly. But as these public health experts said to me, the gating idea, phasing in, that's the right way to do it, except you have to have data-driven measurements of when each state is ready to make that leap into the first phase.
Well, yeah. And my God, John Heilemann, very little death, almost nothing. It sounds like the last clip that you show from February the 28th. The guy just doesn't learn. Yeah. He is a day trader. He doesn't learn. And again, let's open states that can reopen, but with no testing, there's no way that we can actually get a better understanding of how things are going. And again, he has no answer for testing. People have been hammering him on testing nonstop for, I don't know, weeks, over a month, and still nothing when it comes to testing. He can't do it.
Yes, I believe I've heard him get hammered on that question on this show consistently for at least a month and maybe more. And I find it just utterly baffling how the answer could be, we have the capacity to do the testing, but we just don't think it's necessary in some of these states because they've been lucky so far and have not had significant numbers of cases or outbreaks. I mean, if you had the capacity, why on earth would you not, in fact, want to deploy it in a wide way? I think, I think you're right, Joe. I think this really is the Achilles heel for the president. He has overpromised on testing. At the same time, he's been hammered on it by people like you and others, and people have raised it over and over again. If you go back and look at the record there, we should do another calendar on this. Going back and looking at the record of the promises that have been made by the government in terms of how many tests were made, how many tests would be available. They have set forward various milestones and dozens of times. Literally, I think at least more than a dozen times, someone from that podium, whether it's the president or the vice president, has said we will have X number of millions of tests deployed or available by X date. And every time we've passed that date and nothing like that number of tests have been available. And I'm utterly befuddled by why it is the case that they have continually gotten this wrong, missed the mark so many times. But I also am equally befuddled by the fact that the president can stand up there and claim, oh, yes, we have the capacity to do it, but we just aren't going to bother. It seems totally foolish to me and a recipe for disaster, because the reality is what we have learned about this virus is how virulent it is, just how fast it moves. And it's not going to take much in some of these states that don't have many cases now for there to be outbreaks that will suddenly flare up. And they're going to be states that the president cares a lot about politically. And when they happen, we're going to find ourselves having to go back into, I think this is the great fear for everyone, is that because of those kind of outbreaks and resurgences in the states that have already been hard hit and are just on the cusp right now of having a handle on this problem, that we're going to find ourselves back in the summer again, having to go back to what we have been through for the last several weeks. And that will be good for no one. Economically, not good for anyone, and certainly not good politically for the president of the United States or anyone else.
Well, let's pray that doesn't happen, but I'm so concerned that it might just happen. And as I've said from the beginning, and a lot of people have said from the beginning, that this is a healthcare crisis, and the economic crisis that is attached to the healthcare crisis will go away when the healthcare crisis goes away, when the numbers are spiking straight up, when we don't have testing. And I'm sorry to sound like a broken record, but this really is critically important. It's not the end-all, be-all. But it is critically important that we, and how many times have you heard this from Dr. Fauci and others? We've got to test. We've got to be able to trace the cases. We've got to be able to treat people. We've got to be able to isolate those. The asymptomatic carriers are explosive. And Mika, you know, another way this is not like the flu is that during flu season, we don't have mass graves in the Bronx.
Never seen that.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.